All right. Good afternoon, everyone. Although looking at the light outside, it feels more like good night almost. So stay with us because I think what we are going to talk about today is a little bit of what we hope is the road ahead. Many of you know me. It's lovely to see many of you again, and it's an honor to be back here in Bhutan. So, really big thank you to Bhutan Foundation for asking us to come on and consult on this really forward thinking idea. When we first talked about it, the first name that came to my head was Professor John Ravenscroft, someone who has immense expertise and experience in setting up, running, evaluating, guiding national registries. So today's presentation is sort of a joint presentation between the two of us, where we hope to be able to make visible, more visible, what and unpack this idea and word a registry. What does that actually mean? But before I begin, I want to ask John to
Yes,
just
I,
say.
I just wanted to particularly say it's what an honor to be in this wonderful country of Bhutan. I've only been here maybe 11 hours and I've already met some really good friends. And thank you, the Bhutan Foundation, for inviting me. And I just can't wait to meet more people and to really hope to support you in driving this call for a registry. But more on that later. Namita.
Okay, so I want to start with what a registry is. A disability registry really captures three important areas. One is people with disabilities themselves, what they actually need, and this is really important. It's not just a declaration of impairment, but it also captures what is the person's actual need, and then what are the services the person needs and actually uses. So bringing these three important points together is a very important role a registry plays for a country. So today we'll talk a little bit specifically about the challenge that Bhutan as a nation faces in providing solid services and supports to people with disabilities. We'll move on to presenting the registry as a solution. We'll share with you, data from around the world, other countries, other programs, other registries to help you understand why we think this is such a good idea. And then we'll bring it back into Bhutan to show how it actually maps on to everything that you declare is important to you as a nation. We talk a little bit about how it will support, what kind of information it will deliver, and how it will therefore support your actions. We talk a little bit about how a registry is actually built or constructed, and then we end dramatically. Right? To set the context, I often do this because, as was discussed today, the acts, the policies in Bhutan are always beautiful. They're always worded with such wisdom, such clarity of thought, that I often use them not just when I'm in Bhutan, but outside, because they really encapsulate so many important things. This is from the Sen Division's vision, brought out in 2011, 2012. And it starts with this wonderful statement, recognizing that all human beings are born with unique gifts and abilities to contribute to the development of the nation and self. And I think that this recognition is essential, it's fundamental, and it starts out by saying that each and every one of us, people with, people without impairment, hold in us capacity, and if not direct economic contribution to a nation, at the very least, a solid, our responsibility as a nation supporting its people is to develop within ourselves who we are, who we want to be, right? It also talks about equal opportunity to every citizen. And I think this is the one thing that has been perhaps misinterpreted the most, and something that I think a registry will make visible. Equal opportunity doesn't mean the same thing for everybody. And we'll come back to that again in a minute. When I look at Bhutan, when I first came here in 2012, it was at the invitation of the Ministry of Education, the SEN department. At that time, you had just hit 12 SEN schools, or just hitting 12 SEN schools. And I got at that time the opportunity to travel the length and breadth of this country, visiting each of these SEN schools to help the SEN department think ahead. What should we do? How do we go about this? What should it be? And at that time, talking with the ministry, talking with various people involved, both in policy development as well as active service on the ground, I kept bumping up against these ideas that were so interesting. One very strongly held view was very beautifully put by the gentleman who said this to me. He said, we're a mountainous country. We are cold most of the time. We don't have viruses, and therefore we don't have disability. I think the same year is when you first brought out the 2012, I think was when you brought out the two-stage disability study, which sort of said something a little different. So you already had SEN schools, you already had SEN programs, but a lot of the people involved in creating these policies, guiding these policies, and implementing these policies basically felt like, well, we need to do it because that's what we're told good people do, but we don't really have people with disabilities. I think this is a problem that we often face. Each department, each school, each institute, we all carry out our duty. We are given our duty and we perform it. But unless inside each of us there is clarity that where you fit in the larger puzzle, you can really get lost, right? You just do your job and you stop. And that results in a lot of fragmentation. Bhutan holds a very, very, very tempting dream for anyone involved in intervention. You have a small population, a number of 50,000 people with disabilities is something that fits in my city, you know. When I think of less than 2,000 children in a school system, wow, what a dream, what a dream. But then when you look at the country, you are 20 times as big as my city. And trying to reach services in a sensible, affordable, effective manner across the length and breadth of the country requires really good planning. And really good planning requires really good data, right? So I want to give you some stories to remind you what happens when you don't have really good data, but you have really committed people, all of whom work really, really hard. I mean, listening to the panels today, this much is clear. There is passion, there is dedication, and there is a real desire and intent to make a difference. And yet, this is one of the first things. One of my expertise is working with children with hearing and vision loss. And it's always a question I ask in all the countries of Asia that I've worked in. Do you have kids who are deaf and visually impaired? Kids who are blind and hearing impaired? And usually the answer I say is no, and after a few years in country, they emerge somehow. So when I first asked this question, I was told, you know, a couple of years ago, there was this child that came to us. The family had moved to her for work, I think, and then they had this little kid, and then she came to us at Thimphu, the referral hospital. We did this assessment, and then we explained to them, you know, really there really wasn't much that we could do, and that the child should go ahead to the one school in the country, right across over to the east, where we do provide these services. And they actually did go there because I think we're talking about the same family, because when I went to Kaling, I asked them and they said, yeah, that's right, we had a child. from all the way across the other side of the country. But when she came to us, she was about 8 years old, and the kid didn't even talk. And we wondered what was going on, because she seemed pretty smart. And we figured out that we think she doesn't hear very well. So we sent her back for the test. And so the family at some point goes back. And sure enough, the child does have a hearing loss, and so they're sent to Paro, because that's where the school for the deaf is. And the school for the deaf remembers that. And they said, yeah, there was a kid who was blind. She couldn't see very well. And then she couldn't hear. But then, we don't know what to do with this child. So we said, you go back there, at least they'll get literacy. And guess what? No one knows where the kid is. The last known, she was about 12, 13. And then she's faded out of every system. We don't know where she is. We don't even know if we're talking about 1 or 2 people, or maybe even 3. Right? Here's another issue that I often hear. We're a country with low resources. We're a country with low resources. You're a country with better resources than many of your neighbors. But it is true, you are a country with low resources. And low resources mean effective planning is essential. It does not mean that everyone gets everything. Every Dzongkhag does everything every other Dzongkhag gets. No, it does not mean that. It means that you need to know where people are, and you need to be able to do service delivery. And the way it works, when you have a small population, you don't have all the expertise you require, and it takes years to build in-country expertise. What you need to be able to do as a planner is to sit today and anticipate 5 years down the line, 3 years down the line, who needs what and where, right? And then you need to figure out how to actually solve that problem. Last year, I was speaking with the School for the Deaf, Wangsel, and I asked where today, where are most of your children from, like the biggest percentage? And I got the answer, it was Mongar. So you just look at the map, and you see that a large percentage of the children in the school in Wangsel today actually come from one place, Mongar. And you want to think, well, I don't know if this is historical. That's one question, Ministry of Health. I don't know, how long this is going to last, but I do know that today I can count and tell you how many kids, what is their age, where are they in the educational system, and what they may want to do tomorrow. One solution is to just keep everyone where they are, however old they get. And another solution is to look at Mongar and say, can I start getting ready today for the children of tomorrow, who will be adults, so that they may be integrated into their own community. And what that can look like can be a summer camp, it can look like a vocational training, it can look like sign language classes in your schools, just for fun. Why not? It can look like many, many things, because you now know where your kids are from. Right? So again, this thing that I keep coming back to, equality or equity, I know that everybody must hear this endlessly, but somehow it does not seem to translate into practice. Equity is not about treating everyone equally. Everyone needs to be treated justly according to what they need. And that's the big difference, right? So when you have a small population, 50,000 people with disabilities or less, it actually means that you can plan and can plan well. So what I think would be really effective for today's generation, for the people who exist today, for the children who are born now, for the kids who are in ECCD, the kids who are in school, the young adults, and the adults, all of whom have disability, is what I call nimble planning. What nimble planning is you don't plan for a static population. You don't make a single one solid, heavy, rule-bound system. But you make a system that does respond to the reality that people who are born grow older, right? As you grow older, your needs change. your geography changes, your biology changes, your heart changes, everything changes, and the system needs to make space for you. So Wang Mo's son, who's fantastic at math and fantastic at science and fantastic at art, shouldn't have to choose, I will be a functional, follow one program and no other. He should have a system that allows him to pick and choose and gather and develop his capacity so that he can use that as an adult. Right? So our system today has to make that accommodation. We can't wait for policy ideas to become policy, policy to become law, law to become training, and then slowly, by the time he's married and has kids. So we need to move faster than that. It also needs to recognize that disability doesn't always happen at birth. Disability happens because you had a stroke. Disability happens because you had a seizure. Disability happens with an accident, with an illness, to anyone at any point in their life. And so a system needs to be able to open its doors as people require a need. There is a balance between being really specific. I need a diagnosis, I need a certification, I need a prescription, and then I'm stuck with it for the rest of my life. That's not a good plan. That's not a nimble system. And that's not going to provide equity. Right? A registry allows you to accommodate these differences. And a registry allows you to also watch and plan how well your system has responded to a person's need. What we have right now is actually every department has its own monitoring and evaluation. And it's very rigorously done and very rigorously carried out. So I know that around the time of the year when this evaluation happens, everything else stops because everyone knows they are held accountable. But you're evaluating yourself, your goals, your progress, your performance, and that's the end. What we are not able to evaluate when we look at systems like that is how well the systems interact with each other. The child was identified, the child was referred. How long before the child actually got the service? The child was enrolled, the child showed up. What was the outcome? The child went through 12 years of schooling. What are they doing now? So where is a system that actually shows you not just a map of who are the kids, where they are, but also how are they using the systems we already have in place? Because this then allows you to say, maybe I don't have the right system, or maybe I need more systems, or maybe I need less systems, or maybe I need to change the box, right? Maybe I don't need one big hospital. I need my experts to move out into the field. Maybe I need to do intensive summer camps. So whatever the solution you come up with is something that responds to the needs of the people and looks at the efficacy of a system, not just against a plan that was devised every 5 years, but looks at whether each individual plan has resulted in a better life, best supports for a person with a disability, right? So the challenges that we have today in Bhutan is that our data is fragmented, that we hold, each ministry or each organization holds good information, but they are separate and not always with the same language, so that it's not easy to just call up data. That many people with disabilities, especially if they've slipped out of that early going to the hospital, following a predictable path, are not identified, not documented. That the way the services are designed is not always very efficient, that people have to wait years, travel very far, travel multiple times, and not receive enough of support just because of how the systems or services are designed. And as a result, there are a lot of missed opportunities, which is really, really not acceptable. Importantly also, as we said, the evidence of how well we are doing is not just that we did what we were told to do, but also looking at, is our service delivery actually changing the quality of life for our citizens? So the solution that we are putting forward is to create a national disability register, right? To create a national system across all ministries, across all organizations, that ties together this data. And John will talk in much more detail about what a system like this actually looks like. But what is important is that it, especially in Bhutan's context, that if we tie everything to certification, you're going to really, really run into a problem again, because we know that certification takes time. We also know from many of our panelists today how they sometimes got the certification when they were in the child was no longer a child, was in his 20s. That wrong certification was received as a child. So tying services very tightly to certification is a concern. There needs to be an actual functional component that allows you as a professional to respond to a need, not just a piece of paper. So there are many elements of this that I think John will take up and continue. May I hand it to you now? Yeah.
Thank you very much. So in that, and thank you for setting the scene, Namita. We're going to talk a little bit about that. Obviously, any register that we have, and I have developed a register in Australia, in Scotland. I'm developing 3 registers in Europe and 1 in the US. Is that it has to be secure. It has to be content. It has to be secure, and that means you have to think seriously about where are you going to place that register, who's going to hold the register, and I'll talk about that. Registers that I've developed and helped set up talks about and captures disability type of information, the functional needs, and it really supports and feeds into and uses referral systems from the registry, for it connects that health, education, social work, as we call it, and other organizations that help to support. So it's this central location, central place, if you want it to be. And of course, it provides real-time planning. So for ministry services, it provides who has the support now, what do we need it in the future, and it provides that accurate time now, which I don't think certification does, but registry does. It is able to go in and has that dashboard now. And I think what's really exciting about the plan for Bhutan is that it's going to be, or would like to be, something that follows the individuals right across the lifespan. And I think that is, in some sense, quite unique, because not all registries do that. Some stop at 18, some stop at 25. And this is really an opportunity, I think, for Bhutan, in some sense, to become a world leader in this. And I think that's quite exciting and a world opportunity to do that. And of course, rights-based and respecting those privacy. So like I say, we want to build this registry because it should be person-centered. It should be about the children and the people with disabilities. We've heard a lot about that. It should be rights-based, and I think that's absolutely true. And it should be built for people with disabilities, not for disabilities. So I think that's a key system that we have here. So like I say, the registry, in my eyes and in my sense, and the registries that I've built across the world, act as this coordinating infrastructure. It sits in the middle, it is the hub, and everything else is the spoke that goes around it. So like I say, not so much certificate systems are important and can work, but it's not that hub model that I think we really need to do. And the registry can be that coordinating center that sits, and we can have input and a two-way system that flows from hospitals. So hospitals share diagnosis and information with education services along with consent. We can then plan and appropriately think about transition, what kind of services, what kind of assistive technology, what kind of support do children need within the schools that they're going to. We can then coordinate with the social services, we can plan immediate planning, we can have that immediate coordination with families, making sure that that welfare and the benefits and the support from the structures we heard about this morning are all delivered in good time and appropriate time. And we can then really think about how other organizations, CSOs, can help to support and bridge any gaps that are there. And again, of course, being that central location provides that real-time picture for policymakers and governments. And trust me, they love that. So I'm going to talk a little bit about registries across the world, and particularly the one that I run in Scotland. And there are 4 ones that I've identified I think are quite useful to think about. So I'm going to talk about Vincip, the one in Scotland, just a little bit. The Iris registry is quite an interesting registry and worth a look at. Once it gets going, you're able to create all of these data flows seamlessly, and that aggregated goes to the government for that service planning. And that does very well. And the Iris registry is the one that's based in the US, and all services dedicated to visual impairment in the US feed in from the Iris registry. It's got really good information provided there, and I think that's a model we could possibly use here. The iGene registry, again based in the US, had a little bit of work dealing with that. It's very good governance structures to look at. It has different levels of consent, so how much access different organizations and different structures have, which is something we need to think a little bit about here. And it also provides a base for good research across the US also and across the world. And then of course, Namita has told me about India's UDID system there, which provides that standardization and portability. So let's talk about Scotland. I'm here from Scotland. It's a country a little bit like Bhutan. We have some mountains. It's cold. It's windy. But Bhutan is warmer, actually. So it's quite an interesting. So I'm here thinking this is quite a nice winter for me. So it's quite like, it's a little bit like it. So in Scotland, the registry that I run it's called a managed clinical network. And it's that because it sits within the NHS. It sits within the health system. It doesn't sit within a charity or an organization. It sits within the NHS, the government NHS system. Why did we have a registry in Scotland? And this is where Scotland and Bhutan, I think, are very similar, because we had a lot of specialist care, but it wasn't available in these different regions. So Scotland has many, many islands. There's about 1,000 islands. And not all of them are habited, but some of the children there are way out in the islands, some are way up at the main cities of Scotland there. So we wanted to have a system where we know and we understand exactly the level of support, the level of data that each child is getting. And so we built that system so we knew exactly what's missing, and therefore we can prioritize and target those support systems there. We wanted the register to be a vehicle for change and improvement, and I think that's important. It's not there just to audit, to be an accountable system, which I think is what sometimes certification systems are. You just, how many people there attend, right? So what we want to be, a registry should be a vehicle for change. And I think the discussions that I've heard this morning and this afternoon clearly show that, is that there is a need for a registry, and that registry could be that vehicle for change. Clearly needs to work across multi-professionals. Even though it's based within NHS, based within health, we have education, social work at the core of it. So it's not just a health system, it's a system that is supported entirely through education, health and social work. So it's that multi-agency, interdisciplinary system. And of course, it has to be supportive and health. What is good about the registry? Excuse me. It's the aircon, I think it makes you cough, doesn't it? So it is a referral system. So every time we identify a child, about visual impairment here. We have it through the hospital eye team, and the registry becomes the referral system. So the registry automatically will refer to education. We have this child here. This child might be 2 months old. This child might be 16 years old. And it automatically sends information to the education system within Scotland saying, here is this child. This child will be coming into your school. You need to know about this. It sends information to habilitation, how to support the child's daily living skills. And it sends information to organizations about how to deliver emotional support to parents and families. So all of this comes from the registry. It doesn't come from anyone else. It's an automatic data flow from the registry. And it then provides that linkage into specialist pediatric services, and part of that then becomes a multi-agency review that we understand exactly the support that every child has. So it's successful. It's been running now for 10 years. We have around 1,565 children on our registered, and there's clear referral pathways, like I say, between the eye clinic, within schools, and the support services. And what we have identified and what we have learned through having a registry is that we have much earlier identification. So we talked a little bit about early years centres this morning and parents, and that the early years centres refer into the registry and get those children supported much earlier than before. We have these coordinated reviews, so no longer is it just about education, it's about education and health and social support, and we all meet together to talk about each of the child's support needs. We take this holistic view and not a silo view. We have quarterly reports that we give to the government, and thank you very much. And we give these quarterly reports to the government, but we also give them to each of the local authorities, which would be like 20 of your areas. Is that right? You have 20? Yeah, so each of the local authorities gets a quarterly report. How many children with disabilities have we registered? What are they like? And so they themselves, the local area, can start planning themselves. We're aiming to have no child fall through the cracks, and I think that's very important. And if we can do it in a population of 5.5 million, if Bhutan's population is 0.8 million, then I'm sure we can do it, despite these geographical changes. I'm absolutely confident. So what it enables me to do very quickly, this is a map for those who have low vision. I have a map on the screen of Scotland, sort of like a triangle shape, and I know where every child with a visual impairment is. I know about where they are in school, I know what support they're getting, I know what assistive technology they're doing, I know the agencies that are supporting them. I just have to click on a button and it just comes up for me. I know exactly where they live, and if they move, I track them where they move. So many children move in Scotland, what just seems to be one of those things that happens. The average moving is every 7 years. So I can track every child that moves from the Highlands into Edinburgh, or Edinburgh into the Highlands. I don't lose them when they move. They're not lost, because it's part of that education, health and social system. We all refer into the register, and the register refers out. So there is no child that I don't know who has a visual impairment in Scotland. I know where everyone is. I know all about them. In a kind of scary way, but it's a good way. So just some data, very quick data. So I know very quickly if they are new to the system, if they've just appeared. And in Scotland we have many refugees coming in from Ukraine and from Syria. So we need to know if they're new to the system, so we capture that. I know that in Scotland we have more boys than girls who are visually impaired. I know all of their ages. I can easily plan transition periods, and we send that information to the school, so we know when they're going into early childhood centres. We know when they're leaving early childhood centres and they're going to primary school. We know when they leave primary school to go into secondary, and we also know then when they leave in to go into either employment or further higher education. So we know all of this data at a switch. We know all about of their medical diagnosis, their primary conditions, whether it's due to the brain or whether it's due to any other kind of visual impairment. We know all about it. We know all about their additional disabilities that many children have, and we can then coordinate that with all of the agencies and with help about that system there. So I think our register works quite well in Scotland, even though all of our children are all over the country. They are in the mountains, they're in the islands. This central hub feeds that information so that the agencies can support those children, which I don't think, like I say, certificate stations would do that. So how does it align? Well, having been here 11 hours, I know all about Bhutan's policies, but I think it aligns quite well in the gross national happiness scale in terms of ensuring equitable well-being. I think that's really important. It's excellent that you've ratified in 2024 the CRPD, because within that ratification there's a commitment to disability data collection. So it's great. So you've done that, and this would be part of evidencing that you're going to support the CRPD. It clearly aligns with 2019 National Disability Policy, and it clearly aligns with the 5-year plan. What's important for me about registries is that who does it help and who does it support? And clearly the most important people are the people themselves, the families and the people themselves. So what we've noticed in our registration system, it has that coordinated services. So you don't have to, as a parent, and I don't know if this happens in Bhutan, but in Scotland, every time you're seen by a different professional, you have to say the same information. You have to say, yes, my child is this, I have this, I have that. And then next day, tomorrow, you have to say the same thing. And the day after that, you have to say the same thing and the same thing. So all of this used to happen, and you used to, as a family and as a parent, it used to drive you mad, drives you crazy. Why can't you have a coordinated, detailed information? That has stopped now. And this has happened within Scotland because if you're a professional, you would have this information available to you on this consent basis. Our parents noted there's reduced travel. You don't have to go to one part of the country to the other part of the country, because we can coordinate all of those services to meet the parents at the same time. So we can do that. And for parents, they know there's a clear pathway. If you are a parent of a child with disabilities, I think one of the most frightening things for you is, I don't know where to go, I don't know what support I can get, I don't know who can help me and where can help me. But having this registry provides this clear pathway through these coordinated services, and you get then the right appropriate support. For service providers, I think there's a lot of people who can benefit from this. You start then to see the child's holistic needs. Rather than just see the child about its single disability or about its disability, you start to see the whole child. And that for me is really important. It avoids that duplication. You don't need to ask those same questions twice, 3 times. You get much better referrals. You're not missing the support. And part of it is you get measurable outcomes. How well are we doing as a whole and within our own agency? For the government, I think there's a lot of benefits for the registry. As I said, there's real-time data, real-time dashboards. So occasionally I will get the Scottish government phone me up and they will say, hey John, do you know how many? And I can very quickly, within 10 minutes, give them the answer to this. I can give them the dashboard, I can send it to them, and they can then start doing their other national planning. It also, for the government, provides evidence for budgets. So if I am a charity and I want £20 million for this, the government will say, well, what's your evidence? The registry can provide that evidence for the government to either support or not support. It monitors policy, right? How well are the government's policy being implemented? How well can the government implement its teaching, the number of teachers, the number of support services, all of the things we heard this morning from the ministers and from the chief of SEN. It can monitor that implementation there. And if you know where every person is and you can identify their needs, you can then target specialist planning, right? You can really appropriately put the resources in the right place at the right time. And this is what I think Namita was talking about. We don't have to treat everyone the same. We just have to make sure that the resources and the needs are targeted at the right place and at the right time. For organizations, again, that provides the data for advocacy and also to track that program and implement that you've done. So what would you include a register? Now, this is just some information from the registries that I've developed and other ones in the US. Like I say, obviously you would have demographics such as age, gender, location. Many registers across Europe have the International Classification Framework. They have that in. The registries all have ICD, International Classification of Disease, listed, so we know their diagnosis from there, as well as comorbidities and secondary comorbidity conditions. Some of the data registries that we have include assistive products, what has been provided, what rehabilitation services have been provided and by whom, what education supports are included, what health appointments and outcomes of those appointments are included, and what social benefits there. These are just some suggestions, but I think as you develop and think about more of what the registry can do, please, it is a Bhutanese registry, so you would need to make sure that what you include is suitable for Bhutan rather than from anything else. I think it can be done relatively quickly. I'm optimistic that you could develop a register, and certainly within a pilot within 1 year. It's not a thing that needs to be really complicated and not going to start because it's too complex. I don't think that at all. You can start to develop quickly, and I heard just even this afternoon about maybe some pilots of registry data conducting. So you could easily create a pilot, I think, within 1 year, get around 200, 300 individuals to get them registered to see what it would like, the kind of fields that we need, what fields we don't need, what kind of data we want to collect. You can start thinking about training of the staff, what staff needs to be trained, how you're going to enter the data and what systems you're going to enter, and start to think about that data flow and that referral process in and the referral process that. You can do this within a year. Right? From what I've seen here and the enthusiasm and the support both from the government, I think this can be done within a year quite easy. Right? So I'm optimistic for you. And I think if you can do that within a year, you can then scale that up much larger within the second year. So rather than have just 2 areas, you could have all 20 areas, and then you can start to integrate some of that data you already have. And I've just learned about how each system does have good data, and you can start to integrate that into that single registry now across health and education systems. And you can easily do that, I think, within a second year system. And then within the third year, you can add research if you want to, integrate with digital identities, develop mobile systems within that and get apps, and start tracking for those longitudinal outcomes, which as a medic, which is education, which is government, we all want to see. I think when you develop a registry, what you need to think about from the very start is the governance. How's that going to do with clear consent and opt-in systems or opt-out systems, privacy safeguards, end-to-end encryption? All of those things need to be built in from the start and takes a lot of thinking about and work. and obviously needs to be in compliance with the data protection framework. Also have that oversight committee develop, I think. And again, in Scotland and in Australia and in the US and within the Europe, it has been driven by the government. It is a government system, right? It's not within a charity and it's not within separate organizations. It is based within that government system. And I think that is quite important for a lot of reasons, in the sense of security, but it's also in the sense of being able to link across those data. And so that oversight committee needs to have representation from the government as well as disabled people as well. I think it's really important to have disabled people being part of the registry infrastructure. So think about the technology. If you want to develop that pilot, you could do it offline first. It doesn't need to have a strong internet, a strong complex system. We started off using Excel because we had to start on something, and now we do have quite a complex system, but we started off just on a laptop and some Excel systems and some files, which is all that we did. And now, once within the national health system, we use the national health system structure. It has to be interoperable, if I can say the word, which means it needs to connect with other data systems. And you need to think about that as you start building a registry system. What is it going to connect to, and how is it going to connect to? Now, I understand that every person in Bhutan has a unique identifier, so it needs to connect with that would be a good start, right? And that would be a good system to think about that. And then it needs to link to the pupil record. Is there a pupil record within schools? So how would it link to that pupil record? All of these things are, you need to just think about, but are easily solvable. And we have done this across many systems and many things. And again, linking to that digital national identity. So I think the interfaces can be done in any language that you want. It can be simple. I don't think you need to have a complex expertise system. Many people are worried about registers because it takes a they think it's complex and difficult. I'm here to say it isn't really. It doesn't need to be like that. And you can have a really nice simple system on mobile phones or in tablets that can be done in all areas within Bhutan. That gets across that difficulty that Namita was talking about, being the complex geography. But I do think you need to think about open standards in the sense of using international classification codes, particularly around disease, and I think that's quite important in diagnosis because it does then interlink and connect. So why does Bhutan particularly have this condition, whereas we do not see it in other countries? And I think you need to have making sure that you are connected to other open data standards, and I think thinking about that is quite important, and making that data available to the excellent researchers that you have within Bhutan. That needs to be done too. So like I say, year one, you could easily have that done. Think about your evaluation systems from the start. How are you going to evaluate the register? It's not something you should be built in at the end. It's like, my goodness, we've done it. How do we measure it? You need to think about the measuring it from the start. So how we've done it, we talk about, well, have we registered 80 people that we knew about in the pilot study? Have we reduced time? Are parents happy? Are people happy with the register, with the coordination of services? And then year 3, similar kind of thing, but on a much larger scale. So the long-term indicators are, have we got more children within school? Those children with disabilities, are they in school? Are they in early learning centres? Now we'll know, we'll be able to look at that, be able to measure that, and be able to implement that policy a bit more. Do we have higher employment because of that now? Are people with disabilities in employment more now? And again, targeting that. And these are really measurable ideas that can be done from a single registry rather than each individual department. So here are some suggested next steps. I think we do need government and minister approval. I think that's quite important. I do believe that they should be situated in either health or within the cabinet's secretary position, but within health I think is quite important. Get that steering committee set up, get that multi-stakeholder representation set up, I think. Select where you want to do that pilot and get that technology going. You might not want to use Excel, but if you do, that'll be fine. You wouldn't be the first. And start to launch that awareness campaign. We talked a little bit about social media. We talked a little bit about the positive representation. This can all be fit in with that. Get that budget for the pilot, get it done, get that lead agency organized, and then start doing it. Start those pilot studies going. And I think if we can get a minister or a secretary to champion the initiative, I think that would really help, because that then coordinates across education, health, and social protection within Bhutan. So for me, I always see a register is the main infrastructure for inclusion. Just as you invest in roads, as you invest in hospitals and in schools, I think a disability register is essential for the infrastructure of inclusive society. And this is why we have that in Scotland, and which is why I'm developing those in Europe. And I think you can really have a world-leading registry in Bhutan, I think. That from cradle to grave registry is something that's exciting and something that's quite unique, to be honest, like I say. I think it strengthens rights of the person with disabilities. It improves that well-being, and I'm really thinking that it really will support equity across the board, but in the right targeted way. And it provides a transparent data way. It's transparent. There will be issues of consent, but the transparency will be there for all to see. So for me, a registry enables every child identified to be identified early and get supported early. It coordinates services and follows people through life. It evidence-based policies. That's what governments want, is evidence-based policies, and it delivers real impact. And I think that progresses towards your gross national happiness. So Scotland proves that it works, and I think Bhutan values it, and I really think, more importantly, my time here and the parents I've spoken to, children deserve a registry. So I think we really need to work hard and push that forward. So Namita and I would like to say thank you very much. Thank you. How did we do that? Oh, spot on.
Spot on. Thank you very much, Dr. Namita and Professor John, for your invaluable global perspective and expertise, of course. We're truly honored and happy to have you both here as part of the conference. We'll open up the floor for questions.
I think my question also goes to the DPOV also, as well as and one thing that the disabled society here in Bhutan, the kind of disabilities that they have, because the idea for registry is really good, because there is already this, for example, education has EMIS, then the health already has a system, and it's all about integrating these systems in,
Sure.
and then prioritize, maybe a model where these could be fitted in. And the thing is, Anila, because as you mentioned, from childhood to all this record that you have on what sort of disabilities, what could be the possible recommended intervention, if these informations are accessible for educators, health workers. So these things are really good, and it's a very systemized approach. And one simple thing that I noticed, my institution, when we were implementing this digital skilling program, which were targeting like majority of the populations here, and we had this small group of people who had this visual impairment. They really wanted to sit for this digital skilling training, which leads to the global certification. with Pearson. And they had this platform for they had the system which accommodates, the tests for those with disabilities. But then in order to access that, they need to have some sort of a certification to validate that, this person suffers from, is having this kind of disability, say. But then I found that they don't have any sort of certification. Maybe if they had gone to MINSEL, if they had gone to some of the schools, inclusive schools or schools with disabilities, they would have these as a form of validation. So I found like that as and then I think this one gives a really good platform for those with disabilities to at least have some sort of certification to access such opportunities.
Yeah, no, I completely understand the question. Let me tell you how it's changed in Scotland. So in Scotland, in order to access benefit, you also needed a certificate. But that certificate was issued in England. And oh no, you can't do that. It's like asking India to certify for you. So the Scottish government said, well, we have this register. Can the register generate a certificate? And so it does. So now the register is the official certificate that we send out to parents that they then use and get the benefits that they have. But it's been approved from the Scottish government that we can issue the certificates. So it's not a different organization, it all comes from that. So it is like a certificate-based organization, but it comes because the data is on the register. So the Scottish government trusts our data to then verify for benefit. You want to answer? Pretty cool.
Yeah, that is actually really cool. I didn't know that. I was just going to say certification is a service. And it's one of the things that a registry can track. Whatever the system is, if the country doesn't already have a system of certification, certainly what John is saying is brilliant, which is, the data exists, your criteria for certification exist. It's actually just a no-brainer to tie the two together and generate a certificate. So that does make a lot of sense. But if there is an in-country process for certification, that itself becomes one of the services that gets tracked. There's always a balance that you have to maintain. I will still say that in countries like ours, where we have so many challenges to getting evaluated, to getting clarity on what you're dealing with, services should never be held up in order to wait for an official certificate. We have to have that clarity that children and people with disabilities who require services should receive services. Official certification, which is required to access maybe rights, maybe funds, exactly what you're saying, extra time, whatever is granted because of a particular impairment, those things do require certification, but the certification then is something that you put into the registry as one of the services you will track so that nobody gets left out.
I'm hoping to do it within a year and a half because I'm sure that the beauty, like you said about Bhutan, is a lot of the administration and everything is fairly homogeneous. We have the administrator and the local government, where so long as you have the government's approval, I think the process of registry could be faster. And definitely it has actually, it should have been a government undertaking, I give you that. But given the budget limitations, and then we saw a window of opportunity where we could actually propose, so why not have a national registry, but the final data could be parked with the government. And so that's when you were saying a multi-sectoral steering committee be formed, and then we might as well start it with an Excel sheet. It's a huge endeavor, and it's a national undertaking, and even just the thought of it is quite exhausting actually, but it's a necessary process, and we hope that by end of a year or so, or maybe 2 years down the line, we have a fully consolidated data in Bhutan, which different stakeholders individually as well as unilaterally could use the data for their set intended purpose. Yeah. So it was sort of like an information as well as maybe you guys could help. Seems like you guys are an expert here. So yeah, maybe even if we're not able to reach out, just throw in a list of standard questionnaires on our way, so that from there we can pick up and then modify, but not dilute it too much that it does not meet the international standard.
Yeah.
So long as it meets the international standard, but we localize it in a way that is relevant to Bhutan. Yeah, thank you.
And congratulations on the grant. Fantastic. What I'm quite interested in asking is, clearly, and I don't know this and I should have asked, clearly the Bhutanese government is developing the National Disability Framework Strategy. I wonder, and I hope, can we get a registry in that strategy? Do you think we could propose, lobby as a collective organization, and because I think if we can get that in that strategy, then happy days, right? Then so I don't know how it works, but I think just listening this afternoon, I thought it would be really good if we can all as a group here today ask to get that put into that national strategy. Great. At least there. All right. Sorry about that. Yeah. Hi.
We are piloting this child-sensitive social protection in one of the central districts in Chemga. So under that, we have a social registry, local social registry for that district, which will help in providing input to develop this national registry. So we are open for collaboration with all the agencies. We wanted to actually have this co-design and co-create the system. So I think in fact we received correspondence from the Bhutan Foundation expressing their interest in this social registry. So we will be, I think, shortly convening kind of a workshop and consultation to actually bring all these stakeholders together and discuss how we go forward in terms of developing this registry.
Wonderful.
Thank you.
6 months then. 1 year? No, I say 6 months. Invite me back.
Okay. The Cabinet Affairs is in the process, and I don't know, things doesn't happen overnight, and there are parallel discussions happening all across different agencies and all that. And I mean, like, regardless of who takes it up, I mean, like, eventually we feel like it will get there, and it will only help Cabinet implement the strategy that you are talking about. This is the powerful infrastructure and a system that will help implement the strategy. And just a point to note, and as a reflection for myself also, it's not a static system. Its data collection is not one time and finished. It should be very dynamic, sort of like a system which allows entry, exit, tracking, and so it's not like a one-time thing that you do. And there were questions about certifications and all that. Eventually that would fall in place, because the first set of data that you will enter into the registry would be the documentation of all that. So I feel like we will be able to connect the dots with the registry. And so to the Cabinet Affairs, for months we have been trying to pursue appointment with the Cabinet, and we saw this potential. We have been floating this idea to various agencies, even to Burma Secretariat, and I was fortunate to have an audience with Gelson as well, so I have also submitted up. So we remain interested. Again, this has to be driven by a government entity like the Cabinet Affairs, and we remain only interested to help the government entity take this forward. Yes.
I just want to say one thing, which is, I think having a system can be hugely empowering. Just simply making things visible allows you to come up with solutions. So it really is, and Bhutan's long been ready. It's literally, as you said, the systems are well tried, tested, really well developed, and they just require that that linking happens and the language remains the same, because that's part of the reason why kids and people get lost, is because the language used in the different systems by the different departments is a little different. So you get categorized differently. All these things are solvable problems. The one thing that is most likely to bring a problem is the act of diagnosis. Diagnosis is tricky. And the more significant and complex the disability is, the harder it is to come to a conclusion. So a system has to be fluid, open, flexible enough that you can still move, even though you don't fit in under the current existing heads. I think that is one thing that I'll say. The other thing that I want to say is that there has to be some amount of bidirectionality. So if a child may be in a school system or at work or at a town as an adult, where you say something's off, and still be able to provide or to reach out, to connect, and to get plugged into the system. So it can't always start with one poor referral hospital in Thimphu carrying the weight of an entire nation. It's not fair. It's not fair on them. You know, when I talk to families, I get the loads of complaints on what they had to wait, or they're not getting enough. But I also know the other side, what it's like to be in the room and have a line that never ends outside. And, you know, it's exhausting. It's exhausting, it's stressful, and it's just not fair. So system has to allow for that amorphous, the reality of our lives, which is you may be 22 before you finally learn what you actually have, or later. And this is not even counting children who are born with a disability, right? Children who are not born with a disability, but children who develop, or adults who develop a disability and then require to enter the system. So please hold our realities, reach out to the rest of the world and get their systems and so on and so forth, but never lose sight of what is a real experience. And this is the value, I think, of the proposal and what DPAB is now holding, which is a wonderful coming together of many perspectives, lived experience of people with disabilities, families who can speak to the challenges that they are facing, and then service providers who can stand up and say, we really want to do our job, but we have practical problems here. So in the end, everybody is well-intentioned, and our system that we create needs to ensure that the child or the adult that requires the support gets the support. So make sure that that visibility is clean and clear. That's the power of a function-focused data system, right? So I'm really, really hoping that this bringing together of many things does not lose sight of that, because the one thing that I've seen in all your identification and registration systems so far is that they are not strong on function. They're strong on, your I'd say more ICD than ICF, and you need to find a way to bring the two together.
Yeah.